When getting a nasogastric tube, I strongly advise you to invest a bit more and get a silicone one compared to a plastic tube. There are two types of nasogastric tubes as far as I know. One is made of plastic. In Thailand, it's sold for 18 baht, so it maybe is less than 60 cents USD. And then you have the silicone one, which is 360 baht. So the silicone one, you only need to change it once every 3 months, while the plastic one has to change on a monthly basis. However, what I noticed with the silicone tube is that because it's softer, it produces less phlegm and mucus when your loved one is on the tube, when the tube is inside your loved one. So it's a softer material. And the nurse who came and did the nose tube change for us also commented that generally for silicone tubes, it is actually easier to put in and to remove because it's soft and it's yielding. My mom have actually had her tube changed. This is her 5th nasogastric tube. So this 5th one is actually the silicone. The previous ones were plastics. The first 2 changes were done in the hospital because the first time when they put in, within about a week, she pulled it out. So they did 2 changes in the hospital. And then 3 more subsequent changes is done by the nurse who come to our place when we call them. It's a very good service that the Thai healthcare system have, whereby they actually go to the person's house. They come from a smaller clinic which is affiliated with the main hospital, government hospital, and then when you call them, they will come and do the changes. So the plastic tube, right, after about I do not know how long, but we take it out always within a month. The tube will harden. When it hardens, right, the period time when we change the tube, it hardened to the fact so much that one part almost broke into 2. So it actually scares me that, if maybe it's through the erosion of the stomach acid, I'm not sure, or through the movement that the patient has. But it almost broke. My mom's one almost broke into 2 in the stomach, the tip in the stomach. So what happened if it breaks into 2 is quite a scary thought, because the plastic was stiffened and it becomes very hard. When it becomes very hard, it's like a twig that can actually poke on the stomach of the person. So whereas for the that is one time of the changes, and then there was some black substance which the nurse told me is a kind of chemical reaction that comes with the plastic tube. The last change we have with the nurse, when she changed the tube, right, there's a lot of black substance, and the tube is also at the bottom part of the stomach, connecting to the stomach, is also very hard. That's why sometimes my mom complained that because my mom had Alzheimer's, so she's not able to express herself well. But she will tell me sometimes, especially when I do the transfer I need to transfer her to the wheelchair and vice versa, I need to put on the gait belt for her when I do the transfer. So sometimes she will complain that there's a bit of pain. So when I saw the tube, right, it is actually quite scary because the tube has got very hard. And also because I had problem with a lot of phlegm. She has a lot of phlegm when she's using, it seems that because I can imagine the tube is hard, so when it brushes against the nasal, her nasal way, her throat, and then her esophagus, it will produce a lot of irritation. So it produces a lot of mucus. And because it's uncomfortable, she always try to use her mitten hand to brush off the nose tube. And I have to change the plaster that connects to the nasogastric tube quite often, at least once a day. So after we put in the silicone tube for her, about a few days ago, I noticed that she has much more less phlegm, and then she doesn't brush against her nose so very often. I believe that it's a more comfortable, the silicone tube is much more comfortable because it's much more yielding and it's flexible. So we will see how it goes, but so far so good. And that is why I would like to advise, if let's say, if if you're going to the hospital, maybe the hospital actually is fitting by default using the plastic tube, which costs much less. So get a silicone tube in your next change and see if you can see any difference or not. So hope this helps. Take care.